please do so. Of course, check your screen name. Ensure that it matches how it appears on the roster. So hello again. Place your name and campus in the chat. Check your screen name. Change it if you need to. In the event that you need to change it, there are 4 dots or ellipses to the right of your square. You click them and a menu pops out, and rename is one of the options. So we'll give you a minute or so to place your name and campus in the chat and check your screen name. As always, these sessions are recorded and they can be viewed by the attendance administrators or the registrars. Okay. All right. So as always, we take that exam pretty early in the week, but there's that class that take the exam on Friday afternoon. So the exam analysis will take place as it has been on that Friday at that same time, on Friday at the same time. And then grades should be posted shortly after the exam analysis. All right, so we are in week 9. We have finished with all of our content. So, it doesn't end here. You have NCLEX and you also have the HESI. So the HESI is pretty near. So go back and toggle back to week 1 and look at those concepts. I suggest chunking it up, but it, depends on your learning style, whatever works best for you. But the HESI, your game for anything, just like the NCLEX is, you just never know. And so make sure that you have a strong understanding of the concepts, because more than likely the questions are next gen. What does that mean? You have to be able to apply what you know about the concept in order to sift through and select the most appropriate answer choice. So we're in week 9. We just did exam 3. And then week 10, which is next week, we will hear from you all, the group projects, presentations, the PowerPoints. Remember, everyone will turn in the exact same finished product. If there were 2 of us on the team, I did 1 slide. The other person on the team completed the other slides. We still put my 1 slide together with the other slides. We turn in that finished product. And of course, it goes through that turning in system. But everyone's turning that same finished PowerPoint, all slides. In addition to that, be ready to talk us through your content. Okay. And then once we finish, we have just 2 things. We go back over more content next week, and then we do the group project. And then that takes us on out. For sure, by the end of next week, probably, I want to say Dr. Mary has already started sending out some HESI information. All campuses do not release at the same time, but as we get that information, we will release it. Nevertheless, you still seek out the information, because remember, it's campus specific. It's based on what that campus has going on as a whole. And also, your HESI may or may not be the time that your classes have been all term. So keep that in mind. So if you have not received information for sure by this time next week, want to reach out. And if we haven't received anything, we haven't posted anything for your campus, reach out to your campus team so that you can get that information, get registered for it, so you will know the date and time and where to be for week 11, which week 11 is when all the HESIs occur. Again, just a reminder, the date and time of your HESIs might not be how your classes have failed all term. And then once you finish with that, we will post the announcement about the remediation. Everyone has to remediate. It is time-based. It is time-based and also score-based. So depending on your score is the amount of time that you spend reviewing the content. It usually populates you some packets, but nevertheless, ensure that you meet that time requirement. Because remember where you're going. You're going to be practicing on your own license and you want to have that good foundation, that NCLEX, you want to sit that one time. So, this is that's just another, that remediation piece is just another time to be reviewing the content, which is what you'll be doing anyways once you finish, for the term up until you take NCLEX. You're going to be reviewing and reviewing anyway. So just go ahead and get started with that. Remember week 12, this is Tuesday, so more than likely we meet at our same time. Just put a pin in it. I don't know. In the past, over the last couple of years, campuses have closed on Wednesdays at noon. That might not happen this year. But nevertheless, if it does, we will let you know for those that have Wednesday, Thursdays, and Friday classes, what the next steps are. But we do, nevertheless, we will meet week 12. We don't meet very long. It is so that we usually go over our scores. We look at how we compare to nationals. And again, we just look at those huge concepts, and we don't spend very much time in, for week 12. So make sure, and it does still count against you in the event that that time is stopped. If we log in for 10 minutes, and that's all we do for 10 minutes, but you don't log in at 10 minutes, it counts against you. So just make sure you just log in, and that will take you in to the end of the term. Right, and I think I have a question in the chat. So again, the exam analysis will take place on Friday, as it has always. The exam analysis, because the last exam is on Friday afternoon, the exam analysis takes place on Friday evening, usually around 5 Eastern Standard Time, no later than 6 o'clock. We usually post those scores. But nevertheless, be looking at that content. All right, so we will start looking at our HESI information. I do want to spend some time with, because it's a combination. Believe it or not, it is a combination of the content and then how do you use that content. So I like to say soft skills and maybe hard skills. Hard skills is the concepts, what you know about therapeutic communication, what you know about the theorist, and how the theorist applies to the situation, the setting that you're working in. But then the other part is those soft skills. It is your study skills. It is whether or not you work in a group to study, you work in a combination of group alone, that you reach out for tutoring. How do you gain? My first question to you is, and I want you to respond in the chat. We'll give you a little time to kind of think it through. How do you best understand or gain understanding about the concepts that we've been going over? And you don't just have to just keep it to this class, but just overall, how have you studied 12 hours? Have you studied 12 minutes every Monday, Wednesday? What technique have you used? Because, and the reason I'm asking this is because sometimes we don't think about some things like, oh, I never really thought about it like that. You try it, it might work, and then it might not. But still, we want to share our the question at hand is, how have you gained understanding of the concepts? Maybe not this class, but in general. So we'll give you about 2 minutes and we're sending responses out to everyone because we want to see what everyone is saying. And then you might end up picking up another tip or something that you might want to add to your toolbox, to your soft skills. How are you ensuring that you understand the concepts? And I'm going to put it on, set my timer here, give you time to respond. And then as people are responding, just take a look at what people are saying. It might be something that you're doing. It might not be. It might be something you haven't thought about, or you try it one time and you may want to revisit it. So make sure that after you post, look and see what everyone else is saying also. Okay, about 40 more seconds. Please share and then read what the others were sharing. Okay. So I see one thing that pretty much is universal with you all is that repetition. It does. And then it's a new one for me. Tiffany, Chat GPT creates practice tests. Didn't know that. I'm not really that much familiar with that anyways. GPT overall. But she said it generates practice tests and scores for every question. That's neat. But what I'm generally the theme looks like just making sure you're spending time with the content, whether or not it is rewatching, if you're talking with the peers about that concept, because believe in someone says the different exam reviews, we all talk about the same thing, but we discuss it differently. And sometimes the way one person says it sticks with you. And sometimes, the other ways, it doesn't, it's like a blah, blah, blah to you. But nevertheless, that repetition in different, turn on the timer off, in different ways, that repetition, create a quiz and do it over until I get it. Okay. Good repetition. And then put it into, if you're having to, if you're creating your own quizzes, then just like I say, put it in your own information that you can understand. Just don't change the definition of what the concept is, but just think of it as if you're teaching a layperson about whatever the concept is. Because remember, lay people, they don't have this medical knowledge that you have. So we have to communicate in a way that they can understand. So if you can create a situation or a scenario, make believe scenario that you're discussing this, that you're leading the conversation, you're doing a seminar, you're at the unit, you're getting that unit-based training, you're the one that's doing the unit-based training for that week or that month. What are you saying to the people? What are you saying to your colleagues and everything? So good. So again, it is not just knowing those concepts, but how do we gain that understanding um, of the concept? So hopefully you have seen something and you can add to your toolbox. But if whatever you're using works, by all means continue with that. All right, so just wanted to bring that to your attention because we got to have that understanding of those concepts. Because I know most people don't really like next gen, but if you think about it, even when a person comes into urgent care, even if you're working in that public health setting, they're coming in to get, I could think back about the vaccination clinics, or you working in that vaccination clinic inside of that public health facility. They're just coming in for that one thing. But still, you need to know some other things about that person. First of all, get to identify who they are. Do they have any allergies? Do they have any disease processes, or are they taking any medications that's going to contraindicate? Then we're teaching about the injections, the vaccinations that we're given. Not only that, we're observing for signs and symptoms. So the next gene, I know it's kind of scary, but if you think about it, it's more realistic because one person. It's rare that even that one baby that's coming in, that's getting their vaccinations, they're coming in to get their well checked. What's that parent's history? What's the mom's history? What's the father's history? So it's still more than just one thing that we're having to think about and consider. All right. So that nursing process, let me share my screen here. Can't get away from that nursing process. Believe it or not, it does help us sift through, think through the information that we have. Because rarely is that you don't have the information. It's just you have so much information, you're needing to sift through it and gain understanding of it. So this nursing process, it does helps us to have that structured thought process. We're analyzing, we're gathering that information, subjective, objective. Was it chart obtained? What was the information? Did we ask more focused questions. We have our general head to toe, but if they say yes to some things, then we do ask those more focused questions to gather more information. Where did we use active listening when we were gathering this information? Because remember, we take that information, we're going to analyze it. We're coming up with this plan for the person. We're coming up with these interventions that we're going to implement, that we're going to do. And then, of course, we always want to evaluate to see if the plan, the interventions, the things that we did, if they work or not. Do we need to stick with them? Do we need to change and do something different? So clinical judgment. Now, students have told us that this is heavy on the HESI. Recognizing clues, analyzing what those clues actually mean. So when you're reading through the scenario, sift through and see what, like, once you get to that question, what is this question asking me about? Then go back and look and see if all the information that was in the scenario is really what you need to synthesize and process through. Some of that information is just there, but some of it, they are clues that indicates how to select that best answer for your person. Okay. All right. So the client's needs, of course, safety, safety, safety. Be thinking about that no matter what the setting is, home, if they're coming into the urgent care, even if we're doing a well child check, the child is coming in for one of their well child visits. If we're just administering vaccinations, still, we're thinking about that safety. What if the client is coming into a long-term care facility, just coming in for that 21 or 15-day stay? They're not in their normal environment. They're at risk for falls. Their medications, and we hear this a lot too, the medications that we administer patient in the long-term care facilities, patients will say, hey, well, my medicine at home don't look like this. And so we do want to ensure that we're following those medication administration rights. And then we want to still verify that when they're questioning those meds, and remember, the clients have the right to refuse. We want to ensure that we're coordinating care because we want the clients to get all of the services that they need. If they need physical therapy, if they need, just marching our time here, if they need to follow up with the healthcare provider, if they're needing dressing changes, we don't want it to be that because they were at the doctor's office that they were not able to get their therapy that they needed that day. Because evidence-based has shown that within certain time frames, for example, after surgery, and after post a stroke, depends on what part of the brain that clients can get back to that optimal level prior to, if certain things are done within a certain time frame. So it is really, really important that we're coordinating that care. So nursing concepts, that clinical judgment, that critical thinking. So again, sift through the scenario, identify the concept. There might even be two concepts in the scenario, but then see what the question is asking you. Which concept is it asking you about? And then do they want a response in the positive or the negative? If they're asking you about reteaching, if they're asking you, what's another word that I've seen that they want, in the answer would be in the negative, because if you having to reteach someone, then that means they did not understand and the information that they're giving you is incorrect. So that person would need to be retaught. But if a person, which scenario, which statement best describes that this client understood the intervention, whatever the intervention was. So that would be an answer choice or a response that's in the positive, because it means that they understood that teaching that we reinforced. They understood those discharge instructions that they received. They understood how to do the sliding scale, whatever the intervention was, because they're able to either demonstrate or verbally explain back to you, what's going on. So that's the answer in the positive. So safety, can't get away from safety, you all. Think about safety. The acute care settings, initially those patients come into the ER, they're, whatever is going on right then, it's an unfamiliar environment. Depends on what's going on. Sometimes you may have to repeat yourself. Sometimes you may have to get someone else to come in to assist to provide that reorientation. Sometimes you may have to leave the client alone or reapproach with a different coworker. But for sure, we're not going to practice outside of our scope. So just think about, medication administration, wound care, those things that we've been doing in the simulation lab that we've been doing that got checked off on. And also we were able to perform on our patients in the clinical setting. More than likely, those are skills that's in our scope of practice. So if you have a scenario that that they're saying, hey, the nurse is asking or is being requested that this nurse perform this task, if it is outside the scope of practice, it is not okay. Unfortunately, people will ask you to do things that are not in your scope of practice, but it's up to you as that nurse to know, understand, and then to speak up and say, hey, this is not in my scope of practice. I will not be doing this. So the state's Nurse Practice Acts, facilities, policies, and procedures. The Nurse Practice Act is our scope of practice, is our lawful to-do list, is those things that we can lawfully do. And they're matching, even though the setting might be urgent care, the setting might be long-term or acute care, still that organization's rules and policies are going to match what the our state Nurse Practice Act say that we can lawfully do, which is our scope of practice. Okay. So again, topic safety, effective care, providing, making sure, just thinking about all things safety. Is minimum. You would think it's minimal having a call light in reach, but if I cannot get up, or if in the event that I'm in and something acutely is happening, it might not be best that I get up and walk to the door and try to find the nurse. So making sure those call lights are in reach, the beds are in the lowest positions. If clients are needing, I know you all probably have seen them in facilities, clients' beds are really, really low to the floor and they may have like those mats. If they have these extra devices, then they're needed. So it's important that we make sure that those devices are being utilized as they are designed to, and make sure that just the call light in reach. A person, they're more than likely, they're not at their optimal level of health, but they're getting there. They're gaining their strength back. We wouldn't want them to be getting up, walking around trying to find us, because the risk of them falling and injuring themselves is going to be really, really high. And then we want to do those things that are lawful, that we can lawfully do on our to-do list, our scope of practice, which comes from the Nurse State Practice Act. Because if not, then there can be legal issues. Okay. So again, safety, safety, safety. We want to notify that healthcare provider. If they are not responding, then we need to follow that chain of command and see is there another way of contacting them? Is there someone else? Because most providers, in the event that they are not reachable, they do have a plan B. If they're not on call, they do have someone to respond. Now, when you go into the hospital settings, if a facility does not have, for example, they don't have ortho on call or in reach that day, then they'll divert and transfer those patients to someone else because they can't meet the need for that client there. So think about the different precautions: contact, airborne, droplet, hand hygiene. We do not want to violate HIPAA. So just think about all the different scenarios. Just ride on the elevator, you're in the lunch line, getting, in the cafeteria, you're on the phone and you're talking to that healthcare provider. At the nurse's station, are there visitors around? Or is there a space that we're supposed to go to that's private that we can talk to that patient or that healthcare provider? Because remember, we do want to maintain confidentiality, and the way the nurses stations and the floors are set up, it's kind of easy to breach. So we have to think it through. Do we need to remove ourselves from that area and go to another area to provide that information to the clients or the healthcare provider? The medication administration rights, do you know what they are? What are they? Making sure that we're taking the time to go through those medication administration rights. In the event that the system, there's something wrong, if you have that scanning, well, you can actually scan that barcode and it's not scanned correctly. As you keep getting that bounce back, we need to stop. notify pharmacy, see what's going on, because more than likely something is not matching, because we don't want it to be that we just went on and gave the medication and we didn't follow the procedure. The procedure was scanning. The procedure was having that second nurse to verify the dose. So there are different procedures for different medications, but nevertheless, we want to make sure that we are administering those medications how they are. Like I think I mentioned to you all, one facility, they even had like all the medicines a person got, for example, at noon, they had them in one packet. The only thing with that, if a medication changes, then you have to, and they didn't have the names on it. They had like descriptions, yellow, olive shade, white, yellow, and you have to kind of sift through and kind of decide which one of those meds that needed to be removed if there was a change. So, but they have all these different techniques and styles so that it lessens the chance, because we want to be at 0% when we're talking about medication errors. We don't want to ever get someone the wrong medication. So we want to follow those medication administration rights. Delegation. What are those? And we're going to get to this here in a few, but just these are these main concepts. Delegation. What are those things that we need to be thinking about before we delegate? Is this a task that's on the person's to-do list? Is this in their scope of practice that we can delegate this to this person, this staff member? Is the client stable, or is this client unstable? If it is a task that is on their to-do list, but if this client is unstable, would we still delegate that task? So know what delegation is. If all those rights are not met, then that means that is not appropriate delegation. And even if all the rights are met and we delegate, remember, we're still, as a nurse, we still are not relieved of ensuring that whatever that task was completed and followed up on as indicated. Okay. So, clients have a right to refuse medication. Staff, they can refuse that assignment or that delegation, but have a conversation, and see why they're refusing. Sometimes it is that, they don't have all the information. We want people to make informed decisions about their care. Nurse Practice Act, we talked about that. Medication error safety, you all, safety. In these sentinel events, these are events, that are occurring because either we violated HIPAA, we didn't follow some safety protocol, or those procedures that are in place that are to prevent it. We should not be doing surgery on the right arm when the person signed a consent for the left arm. If we are following those procedures that facilities have in place for us, then we're doing the timeout. We're having more than one person verify. We're stopping everything else. We're focused on just ensuring that we're marking the correct extremity. But sometimes it happens. So when they look back, people say that they were rushed, or they just went on and signed off on something. No, we want to stop and take the time, because we want 0% sentinel events, 0% medication errors. All right, so strategies for being successful on nursing exams. Okay, so we kind of led into this already. I was asking you all, how do you prepare and gain understanding of the content? Okay, so here we go. We're going to take our time and read through these right here. We have step 1, identify the question type. Are they wanting me to select something that is correct that the person is saying? Or do they want me to select something that is incorrect? Because if they're asking you which response indicate that this client needs more teaching or further teaching, then that client is stating something that's incorrect. Okay. So what is the topic? What do you know about it? So step 1, identifying that question. Okay. Are we assessing, or are we getting ready to implement something? Think about ABCs and then Maslow's hierarchy of needs. Think about that. Okay, let's look at this one right here. Spec. Is this client stable or unstable? Is this a potential, or is this a real situation? So potential could be at risk for impaired skin integrity. They actually do not having an opening in the skin, but they're at risk for it because they require turning, repositioning, because they're incontinent. It could be due to various reasons, but that potential is the risk is there for them to fall. They haven't fallen yet. Now, real is they have fallen or they do have that opening in the skin. Okay. So as you're reading through your answer choices, think about it. Is this expected? So, for example, if someone has hypertension and we measure their blood pressure, is it expected that the blood pressure readings, more than like some of them might be above that 120 over 80? Probably so, because person has hypertension, but if they are complying with their medications and it's a good fit for them and they're adding in those lifestyle modifications, then it's more likely to be more close to 120 over 80. Sometimes people take all their medications, do those lifestyle modifications, and they're on the right combination, but the goal is not 120 over 80 for them. It could be 140 over whatever the number is that the physician comes up with. So I said all that to say, if you know a client has just had surgery, they're post-op 1 hour of surgery. Those nerves, those endings, they're waking back up. Is it expected that this client is going to be in pain versus a client is post-op 7 days? Should they be in just, should they pain be a 10, 7 days post-op? More than likely, probably not. That is unexpected. But if they're just 1 hour post-op, it's expected they're going to be more than likely in pain. So just think about those disease processes that you've learned in med-surg, which we went over in geriatrics and all the different peds and all of that. Is this expected versus unexpected? Okay. And then the other piece, has this been going on for a while or is this a new finding for the patient? Chronic versus acute. Okay. Of course, ABCs, and then is this outcome expected? What are the expected outcomes? If we're turning and repositioning this client because they are at risk for impaired skin integrity, if this person is consuming the correct or at least the minimum nutritional amounts, if this person is being well hydrated, the expected outcome is less likely for this client to develop an opening in their skin because they're not just they're turning and being repositioned. The nutritional count is good, so it's least likely that client will end up developing a pressure ulcer. All right. So as you're reading through the exam questions, think about it. Use imagery. Kind of imagine or visualize the client in the situation. Even if we're talking about a client, the client is checking in at the desk and they're asking them about the insurance that they have, and they have a PPO or HMO. If they have Medicare, just give some visual to that. Just kind of imagine. And then vital signs lab assessments, normal versus or abnormal. And then think about the time, like the example that I just gave. The client's 1 hour post-op versus the client being 7 days post-op. The need is going to be a little bit different. Okay. And then what is the age of this client? Geriatrics, pediatrics, adults. Think about that. First doesn't always mean assessment. Actions don't always means to implement. Okay. Just think about it. All right, we got Maslow's on here. We know what those physiological needs are. Food, water, and shelter. An example that I always give. Just had a storm yesterday. There was loss of power, electricity. So prior to the storm coming, that was not an issue. People were going about their merry way, flipping on the light switch, going on about their merry way. After the storm hit and power lines were broken and electricity was, not there, then, water became an issue. It's getting warm. Heat was an issue. So then those things changes. So, but the highest priority, even if someone had damage to their home, shelter now becomes an issue. So we want to ensure that those physiological needs are met. And therefore a person can go up and down this triangle because things like the storm can happen. Someone could lose their job. Someone could have an accident. So they go up and down. But nevertheless, we want these. The highest priority are those physiological needs. Okay. So another way to think about it. So get ready to test your knowledge here in a minute, you all. ABCs, pain, education, well-being, coping, and normal findings here. All right. So they put this little funny in here. Pain for HESI is usually considered psychosocial. Okay, here we go. Airway, breathing, and circulation. We're still saying the same thing. We're just letting you look at it in different ways. And safety. Safety. Can't get away from safety. Another way you can think about it is, well, who's going to die first? We have these 3 patients. We're going to take care of all of them. But if they're asking you which one do we need to take care of first, which client should we give priority to, then airway, breathing, circulation, and safety, or who's going to pass away first, should help you to prioritize which patient we should be seeing first. To prove minimum competency, a beginning nurse must demonstrate ability to make appropriate nursing judgments, need to be able to recognize both expected and unexpected outcomes. Outcomes allow nurse to evaluate whether goals have been met. What is the expected outcome of the action? We're implementing, we're doing dressing changes. We are administering blood pressure medications. What is the expected outcome of us doing those, implementing those interventions? What is the best action for the expected outcome? Will it help, or hurt this situation? Is it desired? These are just some questions that you can just be asking yourself as you're reading through the scenario and trying to select the best response. And you'll be doing the same thing in your mind once you actually get out and you have your own team of patients that you're working to, taking care of as well. Is it credited? Is it an accredited answer? If I can only do one thing, then leave the room. What is that one thing? That's asking a priority. Step 5, outcome used for every question. Okay. All right. So here we go. I am going to let you read through, and then in the chat, you can just put 1, 2, 3, or 4 for your response. Let me give you 3 minutes, and then we will look at this question. Let me get my little timer here. Gonna pause. You can concentrate. Okay. So in the chat, you should place the number 1, 2, 3, or 4. You don't have to write out the answer choice. Just simply place the number 1, 2, 3, or 4. Which clients complain of pain should the nurse respond to first? So this is a priority question. Remember, we're going to take care of all of our clients, but it's asking you which one should we take care of first. Let me go back. Just look at this one real quick. Where's that thing at here? Stable versus unstable, potential versus real, expected versus unexpected. Is this a chronic or is this acute? Okay. ABCs. Did I pass down? Yeah, ABCs, pain, safety. Who are any of these patients at risk of passing away? And if they are, that means they probably having something going on with airway, breathing, and circulation. Okay. Safety. All right. So the threes have it. So we have a client that has bladder spasms after draining 1,000 cc's of urine during insertion of an indwelling catheter. This is expected. This is pretty acute. Flank pain that is partially relieved after passing a renal calculus. That they say those things are painful. Okay, so bladder pain while receiving turn off our timer, while receiving a continuous saline irrigant 2 hours after a TURP, transurethral prostatic resection. So in this one right here, remember we're talking about the example that I gave you earlier. This client is 1 hour post-op versus a couple of days post-op. So this client has had a continuous saline irrigation 2 hours ago, but now they're complaining of bladder pain. That's unexpected. Okay, so that's the one that we need to go ahead and be looking at and going ahead and responding to first. Incisional pain on third day post nephrectomy, none that's expected. Okay, so this is where we're going. We're gonna add. We will review more on next week. So just make sure that you're going back for all of your courses back to week 1, because HESI is everything. NCLEX is your game for everything. So make sure you have that strong foundation. Think about those test taking tips you all share with each other. How you best prepare. So check some of those out and see if you can add some of those to your toolbox. We will see you on next week. Exam scores will be posted on Friday. Take care.